Today's February 13th, 2014, and we're here with Melanie, who is a totally different woman than what you might have seen in previous videos.
That's right.
I haven't done anything with her yet, and she actually walked in today with a smile on her face.
That's right. That's right. That's right.
And no tears today.
No.
You said you can floss your teeth.
I can floss my teeth. I haven't been able to do that for a month. I can brush my teeth. I have had a few moments of pain, but the Oragel is doing much more neurotherapy for me than it was before, right. So it's giving me longer relief.
Let's get your hands over your head.
And
instantly.
Yeah, you got rid of that impingement in my arm.
All right.
That's where it was coming from.
Your neck. All right, turn your head to the right. Oh, that's even better than before.
I've been practicing. See, because I got used to twisting with my whole body.
It's better than me, actually. Bend your head back. Oh my God! Oh my God!
I've been working really hard.
Oh, do that again. Do that again. I want the viewer to see that.
I couldn't do that.
All right, now chin to chest. Okay. Dee, what are your thoughts?
I just can't believe it. It's a miracle.
All right. Well, I'm really happy.
I'm so happy too.
Well, all miracles come from above. They don't come from me.
I know, but you're a guide.
I try to do God's work. That's what I try to do.
You're a guide. You work through God.
Okay. All right, Melanie. We'll do another treatment on you today. All right?
All right.
Well, we just got done your treatment today, and you got even a bigger smile on your face, right?
That's right.
Okay.
That's right.
You just said that the treatments don't bother you as much now.
No.
Because you're in less pain.
I'm in less pain.
So you're coming in more frequently.
That's right. That's right. So, and I learned that when I was doing it with my my dental issues that I've had in the past as well. So that's why I didn't want to stop. I wanted to keep going because I feel myself improving. And one of my other doctors talked to me yesterday and said, Melanie, you're a high energy person. You need to save some of that energy for healing. So don't wear yourself out.
Okay. Well, this is. I'm looking at this camera, your image on the camera, and thinking the first time you walked in here a couple weeks ago.
Yeah, it was just 4 weeks ago. And I was like on my deathbed almost. I was ready to lay down and die. Literally.
I think the viewer could see that.
Yeah, and it was the system. It was the system that I never wanted part of. It's this traditional Western medicine that Obama's now trying to shove down our throat. And most of the people in my generation, we don't believe in it because it's broken. And I've seen it over and over with myself, with my mom, with my family, been in the animal industry. And I have to say, most vets are smarter than the doctors that practice traditional medicine. And there's something wrong with that. If our dogs are getting better health care, you know, there are vets who are doing what you're doing, Dr. Owen. They're using lasers and natural therapies. I've had clients that have herniated discs that vets treat naturally without drugs.
Isn't that interesting?
So, you know.
And you asked me a question. You asked me about kinesiology.
Yes.
Would you, before I explain to the viewer...
I didn't know what it was.
Would you attribute my kinesiology to you getting better?
Oh, absolutely. Oh, yeah. Oh, yeah. You discovered things in my body that I had no idea that other people didn't either. I mean, it took an hour and a half for me to realize that, you know, my wisdom teeth being surgically removed was a surgery. Mm-hmm. And that was part of my problem, was that I wasn't giving an accurate medical history. And that's why my previous chiropractor couldn't help me.
For the viewer, what I do with you in the past couple weeks is I just locate each spinous process on your neck. I touch them or I tap them, and I see what that does to the strength of an indicator muscle. Mm-hmm. And if the indicator muscle weakens, then I infer that there is a problem there, and that's where I've treated, and you're kind of impressed, huh?
You know, it goes along with what I believe. I believe in chiropractic, and I have a whole sheet that my chiropractor gave me where all the things are connected, and the areas that you've been treating, the C7 and the C2, all of my symptoms. It fits all of my symptoms, and that's all I was trying to do, was trying to say that this feels like trigeminal neuralgia, but I don't believe in disease. I believe in that your body's trying to tell you something, and that's what no one would really get to the bottom of. Where's it coming from so we can undo it? And that's what they don't do in traditional medicine.
In traditional medicine, allopathic medicine, all diseases are a description. Trigeminal neuralgia describes the pain.
Yeah.
It doesn't tell you what the cause is.
But I read this really good book by one person who suffered from it, and he talked about how Lyme disease can cause it, misalignment of the spine, you know, all these different things. So I kind of got the idea that, okay, well, if my mom had a metabolic disorder that was completely reversed after kinesiology identified 2 infected root canals, okay, if that could happen with her.
Who did that?
You did that.
I did that.
You did that. You saved my mom. A stupid neurologist.
I am alive
In
still.
traditional Western medicine told me that my mother had to be on seizure drugs and that there was no way for the rest of her life. And I said no. And I encountered it over and over for several years until I finally, because she has a fear of dentists, I got her to a really nice dentist. He got one tooth out, waited a couple months, got the second one out. Completely reversed the disorder, completely. So I don't believe in diseases. I believe that your body's talking to you, and you're the first doctor that taught me that. You have to listen to your body, and that's what the other doctors in traditional medicine, they don't do, and they don't teach you that, and they don't listen.
That is a fantastic lesson for the viewer. Thank you. I couldn't have said that any better. I appreciate that.
Well, I appreciate everything you've done for me. You're giving me my life back, so
Thank you, dear.